So when I'm looking at GU cancer in terms of educational needs, in urothelial cancer, we've brought a new class of drugs, the antibody-drug conjugates in. We need to learn about how to give them. I think there was an assumption that they may be more like immune therapy than chemotherapy, and they're probably not too much like either of those. They're their own distinct class of drugs. They've got their own distinct adverse event profile, and there is a huge educational piece around that. In prostate cancer, I think we have introduced PARP inhibition quite quickly into this space with a biomarker associated with uncertainty. And I think we need to address that and make sure our communication is concise. Should we be treating everyone? Should we be treating the BRCA positive population? We need to address that. And then in kidney cancer, I think the most important issue at the moment is maybe stop talking about the differences between Axi-Pembro and Len-Pen and more about how to give the drugs, how to manage the toxicity safely, because patients are on treatment for life, and that means you're going to have toxicity for life if you don't get that right. And so I'm kind of saying, for me, pick one drug combination, use it well, learn how to give it, and make sure you're supporting patients. So I think that's really relevant. As always, there's a multidisciplinary approach to these cancers, and that multidisciplinary team is getting wider. I think that means we have to educate that whole team, and that's really important. And I think finally, I think that patient involvement in some of the decision making we're making in urothelial cancer, kidney cancer, and prostate cancer is really important. I think bringing patients into steering committees, bringing patients into educational groups, and making sure that we're focusing on the patient needs is really relevant too. And so for me, those are some of the things that are going through my head, which I think are relevant.